Hi again. So now we're going to talk about bowel dysfunction. And I was just thinking about how I wanted to address this and talk about this because there's a lot of things that can go on with your GI system that is definitely, you definitely would need a little bit more intervention with, whether it's through pelvic rehab with our hands on you and doing some what we call visceral work, working your abdominal wall, depending on what your medical history is, or maybe even having a workup with your GI doctor, because there is a lot that can go on here. But I do want to give you some things that you can think about for home and then just kind of explain how good bowel health, how to achieve good bowel health, and then how to make your system work for you. This is an area that causes people a lot of distress. So the first thing that you need to know is that normal bowel function or normal bowel movements occur anywhere from 3 days a week to 3 times a day. So that's all normal. And your normal can vary from week to week. Some people I go to the bathroom at 6 a.m. every morning. I have a perfectly formed stool and things work perfectly. Other people say my stool consistency varies. I can have like little nuggets one day and I can have loose stool the next day and I can't figure it out. And there's a lot of things that can result in those issues. And then other people are saying, like I go once a week, I go once every 2 weeks, I'm bloated, I'm miserable, I'm in pain, I can't get it out when I'm sitting on the toilet, or I know it's right there and it just won't come out. And then there's the people that go, I'm always on the toilet, I go multiple times a day. So there is a very wide range of normal, and it can depend on a lot of different factors, where you are in your health, your diet, your level of activity, and what's going on with the bacteria in your gut, and so on. So there are some things that we can do to improve bowel function. So the first thing I want to do is explain what is required to have a normal functional bowel movement. So our colon comes up on the right side, right? It comes from our small intestine. There's the ileocecal valve, and then it comes up on the right side. So it's kind of like, it comes up here, it goes across, like maybe over your belly button, and then it comes down on the left, and then it enters the rectum and comes out, okay? So up, across, and down. Almost like not a complete square, but that's kind of what it looks like. And so in order for us to have a normal functional bowel movement, 3 things need to happen. First, the colon needs to be able to move well, right? The stool has to be able to move through the colon. So what impacts the movement of that stool in the colon? If the stool does not move quickly enough through the colon, water is absorbed from that stool, and the more it sits in there, the more water is absorbed, and the harder the stool gets, the firmer it gets. And so if you don't have enough water in there, then that's going to be an issue. So the colon needs to have good peristalsis or good activity for it to be able to move. Activity level or exercise is extremely important in allowing that colon to move. So as we walk and we move throughout our day, if we become more sedentary, then we may start to have issues with constipation. The more active we are, the more those hip flexors will massage that colon and get things moving. I had a patient once that was taking care of her elderly mother, and she was helping to paint her apartment. And this woman was very sedentary prior to this, but she spent a couple of weeks going up and down this step stool ladder, and she was active, and it was like she was like a new woman. She came back and she said, I cannot believe the difference that level activity made. And she started a walking program right after that because it completely cured her constipation issues. And that's an extreme case and a great case, but it does happen that if we increase our activity, then we can improve the mobility and the motility of our digestive system. The next thing that has to happen in order for you to have a normal functional bowel movement is that the consistency of the stool needs to be right. So no matter how well you're getting that stool into that rectum and it's ready to come out, if it's really hard, it's going to be really difficult to eliminate it. So we really want to make sure the stool consistency is normal. So I want you, when you get a chance, to Google the Bristol Stool Scale. Bristol, B-R-I-S-T-O-L, Stool, S-T-O-O-L scale. And you'll see pictures of it. And there's different types of stool, okay? And sometimes I'll hold those up for my patients. Type 3 to 4 is normal. And typically what your stool should look like, it's smooth and soft like a sausage or a snake. If it's too loose, it's not normal, and too blobby, okay? Or if it's too hard, it's not normal. So it should never be balls or like separate balls placed together. It should really look like a sausage or a snake. So that stool consistency is ideal, and we need to make sure that that is maintained. So one way to maintain that is through proper hydration. And many of us do not take in enough water. And some of us need more water than others. So I may say you need to get your 8 glasses of water in a day, and it may not be enough for you. You may need to get more in. Remember, as that water is getting pulled from that stool, and that stool is becoming more hard. So you need to constantly be hydrating on a regular basis. The other thing that really helps to improve the consistency of stool, that can help with even fecal incontinence as much as constipation, is fiber intake. This is something that I argue with my patients about all the time, because many of my patients will say, oh, I eat tons of fruits and vegetables and I eat tons of salad. But if you really look at the numbers, salad and lettuce does not have that much fiber in it. We should be getting 25 to 35 grams of fiber a day in. If you really want to look, you can keep a log of how much fiber you're taking. You can look up the fiber content. Most people aren't getting anywhere near that. And sometimes I will make them go home and do a log because they really believe that they're getting enough in, and they're not. It's important that if you're not getting enough fiber in your diet, that you need to gradually increase it, because it can cause bloating and gas if you just kind of throw 25 grams of fiber in your diet after you've been eating 5 for the past year or two. So you want to make sure that you're drinking adequate amounts of water with that fiber intake as well. If you feel like it's too much to get that fiber in through your regular diet, you can supplement with things like Metamucil to try to add a little bit of fiber, but it doesn't add that much. So you really have to look at what you're taking in. But having adequate fiber will allow that stool to stay a little bit softer. And then if you're having an involuntary loss of stool because the stool's kind of like falling out, it can bulk up your stool enough to kind of sit above those muscles so that it's not falling out so easily. So really important. So fiber intake, and the last thing that needs to happen is that bowel movement needs to be able to get out. So we have the colon needs to be moving, the stool has to be in good consistency, and then you need to be able to get it out. And that's where the pelvic floor comes in play. Or it needs to be able to be held in, okay? And that's where this sphincter stuff happens. So we have this anal sphincter right here that doesn't really it's not a super strong muscle, or it's a strong muscle, but it doesn't have a lot of endurance. So it can't really contract for a long time. So we have the anal sphincter, and then we have that little tiny, see this space right here? Think of that as like the anal canal, okay, where my finger's going in. And then we have the rectum that sits above that, which is right above these higher muscles, okay? So once that stool gets into that anal canal, this little muscle right here is going to have a really hard time holding that in, especially if that stool is soft or loose, okay? So we need to improve the endurance of this muscle because it only has about a 60-second endurance level. So once that stool gets in there, you don't have a lot of time to get to the bathroom. So the goal is to make sure that it stays above here until you're ready to have a bowel movement, and then you can walk normally to the bathroom. So we need to be able to not only hold the poop in, but we need to be able to get it out. And a lot of people have problems getting it out, probably just as equally as they're having to be able to keep it in. I probably see actually more trouble with women not being able to get it out. So what we need to know about getting your poop out and allowing you to not put so much pressure down at the bottom of that canister. Remember I said that can cause supportive dysfunction or prolapse? If you bear down and you push too much, you're going to cause problems in other areas, and then we're dealing with more issues. So what needs to happen is that muscle needs to be able to completely relax. That's why I said we need a pelvic floor that can squeeze and hold, but also that can open enough to allow us to get it out. What we know is, and I'm so used to doing this in my room, so I'm going to try to demonstrate on video, but what we know is the best way, let's see if I can get you down next to me, the best way to eliminate is to get yourself into a deep squat position. And this is why they go to the bathroom like this in other countries. This is why women years ago would squat in holes. I don't see if you can see me. So I'm way down into a deep, deep squat, okay? So when in this position, the muscle that kind of closes off the rectum and creates a flat valve called the puborectalis. Okay, so if this is the rectum, the muscle flaps around the rectum and keeps it at a 90-degree angle. So when the poop comes down, it's not falling out, okay? It relaxes the best in a deep squat, okay? It opens up, it lets go a little bit. And so when that muscle, okay, I'm back again. When that muscle is able to open up completely, then we can allow everything to go out. So people are like, well, what am I supposed to do? Squat on the floor to go to the bathroom? If any of you have heard of the squatty potty, it's the most amazing invention in the world. It's a stool, a small plastic stool, and they actually make them in bamboo and different materials, and they actually make travel ones and stuff. If you go on squattypotty.com, you can go on Amazon, they have them. Bed Bath & Beyond sells them. You can get 20% off with your coupons. But it's a stool that goes around the base of the toilet, and it has a spot for each foot to go on. And I always tell people putting a regular stool in front of the toilet might help a little bit, but really helps to get those legs apart, okay? So one on each side. And then when you're done, the stool slides underneath the toilet so you don't trip over it. But putting your feet up on a stool, and I always tell people, there's a 7-inch and a 9-inch, get the higher one because you really can't get high enough to try to be able to eliminate better. Because what happened was, with Western civilization and the advent of the toilet, we started coming to sit on chairs to poop, and now a muscle that was completely relaxed in a squat is only partially relaxed on a toilet. And what's happening to our toilets? They're getting higher and higher, right? So it's getting more and more difficult. And if you're a small, petite woman, you might not even be touching the floor to go to the bathroom. And this could solve your problems completely if that's the case. So squatty potty is a must for anyone having problems with bowels, whether you're having trouble with constipation and getting it out, or you're having trouble holding it in. Because a lot of times people who have fecal incontinence or involuntary loss of feces, no matter how little, it's because they aren't emptying their canal so completely, and then they get up and they walk around and there's still stuff stuck in that little anal canal and it falls out because that anal sphincter doesn't have the endurance. So getting your feet up is going to help you empty that rectum completely, or a little bit more completely, and then learning how to relax that pelvic floor, you can fix all of those other problems. So constipation really is a major issue, and it's really a big problem for a lot of people, and a big source of discomfort and pelvic pain, because you can create more dysfunction by trying to push your stool out in terms of injuring your body and your organs, and also causing muscular injury as well. So the other thing that I like to tell people about is that you can do some things that can help you go to the bathroom a little bit more easily, is that you can do some belly massage, always coming up from the right. Remember I said that the stool comes up this way and goes across and down. Just kind of doing like a nice circular belly massage, get some lotion and kind of massage it out. If you feel any hard areas on your belly, just kind of like massage them down, and that will kind of help stimulate that movement of your bowels. So it's a nice thing. So again, it's like up and across and down. So this is a very general way to do it, but it can kind of help a little bit. And then also taking a warm bath and sitting in the warm bath can help to relax. And we call that, parasympathetic nervous system, or that part of the nervous system that calms us down. We call that the rest and digest part of the nervous system for a reason. Okay. As far as involuntary loss of urine or fecal incontinence, it's very common for people to experience involuntary loss. Sorry, did I say urine? I meant feces. To lose feces involuntarily if the stool is too loose. So even the best of us, with the best pelvic floors, can lose stool when there's a severe episode of diarrhea. So just know that if that's something that you experience often, then you need to go look at your diet and try to bulk up that stool and improve that. Sometimes the effects of chemotherapy and things like that, and even radiation can cause that to happen temporarily. So, trying to mitigate that by changing some things. Maybe even taking some probiotics and trying to change your gut flora a little bit. Radiation is also a very common, pelvic radiation is a very common cause of fecal incontinence. So we really help to work with those patients by teaching them how to strengthen and activate the muscles around the pelvic floor. And that's where the Kegels that I taught you in the last session come in, where you can start doing a Kegel home program, and then again learning how to do that bracing and that holding and that engaging of the canister to not let a lot of pressure come down, because if you're bearing down a lot, you're actually pushing that stool down. So fecal incontinence can be controlled typically by getting that pelvic floor working and moving a little bit better. That is all I have right now for bowel function. If you have any questions, feel free to send them my way somehow. And I believe that Gloria Gemma Foundation is going to get you that information. Thank you.